Thanksgiving was 2 weeks ago, and we have not seen the surge that many people were fearing. Dr. Jeff Pothof with UW Health is joining us now to talk about this. Dr. Pothof, we just heard from Public Health Matters in Dane County about the plateau in numbers. What does that tell you?
This is good news. I think all of us were really worried that we would have this big spike coming out of Thanksgiving. And although other parts of the country are seeing exactly that, we're not seeing that here in Wisconsin right now. And that's great news because hospital systems in Wisconsin were having a really rough time. So, we're still close to the edge of the cliff, but we've taken a step back, and that breathing room is welcome.
Could we still see a surge? And what about Christmas?
Yeah, it's possible that we could still see a bit of a surge. Oftentimes, people who get COVID-19, it takes a few days for them to develop symptoms that are severe enough to get a test or to need hospitalization. So we're still looking at this next week, although we would have thought that we've seen cases already. Now, Christmas, if people stayed home during Thanksgiving, if they can stay home over Christmas, that might be the last big holiday where they have to be so locked down for the holiday because vaccines are just, imminent on the horizon.
Yeah, once we do get a vaccine, when do you think it'll make a substantial difference?
It'll really depend on when a large number of people get vaccinated. One of the things we don't know yet about the vaccine, we know that it keeps you from getting sick from the disease. You're probably not going to die of COVID-19 if you get a vaccine. We don't know if you're still able to pass it to other people who haven't been vaccinated. So we need to wait for that data to come out. Until that data comes out, even though you may be protected, it'd be good to be masked, to be distanced, so that you don't infect other people who haven't been vaccinated yet.
All right, Dr. Jeff Pothof with UW Health, thank you as always.
You bet.